Professor Senn, first of all, is there a role for the American physician to present and work with you collaboratively at the St. Gallen meeting?
Well, we have a disproportionately high number of American speakers at the meeting. You see, all aspects of the primary treatment, initial curative treatment of breast cancer, surgical, medical, radiotherapeutical, are covered in a 3-day meeting in various sessions. But the speakers are selected by us, by an international committee, not by me, but by about 25 people who know how to get along with treatment of breast cancer. And after these 3 days of up-to-date presentations, I would say state-of-the-art lectures. And then this panel gets into action on Saturday. It's the only meeting I know worldwide where on Saturday, on the last day of the meeting, there are more people there than before. In all other meetings, people get away on Friday afternoon, and Saturday you have plenty space to sit down all around, but not here. And we assemble about 5,000 breast cancer-oriented specialists from all over the world, from about 110 countries.
Now at this meeting in San Antonio, there's a very active involvement of the breast cancer advocates. Where do you see the role in Europe? And it's really an emerging role for breast cancer, well, for advocacy in general, but let's focus on breast advocates.
That's a good question. So far, we have involved the advocates only in the panel. So you see, Europa Donna is maybe the leading, yes, the leading institution over there, or advocacy group, and a representative from Europa Donna is always on that panel, so she can. It's a lady, actually, and normally, and she can also give her input into this treatment consensus. But we have so far only locally done for laypersons some kind of parallel meetings. And this is always a problem because we are so busy with the other meeting and with all the other sessions that this maybe is coming a little bit short. We should probably do something about it, and I'm glad you mentioned it. We are thinking about, but we do not want to enlarge the meeting even more, then it gets even more complicated. Because for laypersons and systems like Europa Donna, there are other meetings. There is a European Breast Cancer Conference where the advocacy groups have a large part of input, and we do not want to duplicate this.
Professor Senn, I was preparing for the conference and reading through some of the press briefings, and it was really astounding to read one of the presentations about the failure by so many women. I think it's like 50% of women who do not do their screening and get mammography. And I'm just wondering, what is the status of screening and active mammography in Europe? And I know in Europe it's different because you're dealing with regions.
It's very variable. It depends on the country, and it depends on the country's medical system, and especially on the insurance systems. If there is state medicine, such as in England, for example, or Sweden, or Denmark, this, I think, has been done for years. Most European countries which belong to the so-called European Union have actually, they should have a nationwide breast cancer screening program, mammography screening.
It's the utilization by women that has me concerned, because in reading this report it says only half of eligible women in the United States are getting their annual mammograms, even if they have insurance to pay. So I'm wondering, and there may be reasons for this, we don't exactly know, but you know, some women complain because the mammograms are painful, but for 1 minute with the compression. But putting that aside, what are there philosophic issues, or you know, what's the mentality?
I think we have the same problems. I think we have them even more, even in countries where it's it's actually nearly mandatory to go there, or that it's at least no problem of payment, you see. Even in countries like Germany, for example, where it's paid, depending on the region, very variable percentages of women between 50 and 70 are actually doing mammograms. And we have the same problem in Switzerland. We have regions where, like in Western Switzerland, it is organized since 10 years, though these Western Swiss cantons would have it and the insurance would pay for, but only between 50 and 70% of women go. And in Eastern Switzerland, our canton, which is corresponding to the US states, the canton of St. Gallen has now started such a program, but only about 30% of women are going there. That is a big problem with mammography in Europe, and it is because, you see, mammography involves radiation. And radiation is perceived by especially females from the green movement as something extremely harmful and not necessary, which should be reduced and condemned and so on, depend on their own palpation of the breast and on clinical examination by their doctors, of which we know that it's actually not going to reduce mortality. This is a problem, it's a cultural problem which we cannot just put aside.